we're gonna touch on a few content today, mostly what is joint arthritis in dog. You guys most probably is very well aware of this. Choices of joint solution that has in the market, clinical trial that support the joint solution that we bring in from US, Maximus joint booster or Maximus joint, which one to choose from, and Maximus Pro GI. Technically, a joint supplement, a joint arthritis is basically an inflammation of the joint. It can affect multiple joints. Two of the most common types are osteoarthritis and rheumatoid arthritis. Now, in animal, normally we will see osteoarthritis. So 70% of senior dogs above the age of 7 will have certain kind of osteoarthritis. So, and as many as 20% of dogs have osteoarthritis so far in the market, it is sometimes due to a diet. So, the norm of arthritis in dogs is why they are having it normally wear and tear, stress, injury, genetic, and aging. So, what do we have in the market that normally is being used for treatment of joint arthritis? Now, nutraceutical has something very special in kind of preventing joint problems, okay? And also preventing other sickness. Because why do you need nutraceutical in your practice? Because you cannot be taking paracetamol before you have fever. You understand what I mean? You cannot have NSAID before you have a pain. So medicine just cannot do for prevention. But consumers right now, they are being educated online to become a veterinary doctor. Sometimes they become a specialist doctors. So due to internet and due to things that people write on the web, and they think they have such a great knowledge. And also because of that, they love their pet so much, they want to buy things to prevent the sickness from happening. It is not like 30 years ago whereby a dog cannot walk and then they come to you and then they want a jab so that the dog can walk back, and every 2 weeks they'll bring in for a jab so that the dog will walk back. But nowadays consumer mindset changed. So the veterinary practice, so-called, due to sustainability of business, we need to change as well. And that is why nutraceutical is very important in the practice. So glucosamine, very popular product. This is one of the products that comes into the world and it changes the whole thinking of joint solution, right? And all this while before glucosamine was there, painkiller is the only solution. People take calcium as a solution. They think that taking calcium might stop the deterioration of the joint, but actually no. See, calcium is not 100% digested into the body. So we have chondroitin, also as one of the supplement that comes into the world that actually derived from shark cartilage, and it actually helps to loosen the muscles around the joint so that it can move freely. Curcumin, turmeric is also one of it, which is very popular right now. But again, curcumin has a problem of too large of a molecular size, meaning that human, including animal, has a very hard time of ingesting or absorbing the curcumin into the system. And if it's being absorbed into the system, it does not stay long enough in the system to perform a strong anti-inflammation function until pediatric laboratories launch Maximus Hep, which is the patented QQ Life curcumin. Steroid NSAID work fast, very good, but not for long term and only for selected dogs. So certain dogs cannot take NSAID and steroids due to allergies, due to gastric problem, and many other symptoms. Well, diet's not effective. All this while we've been taking good food and good diet, but still the joint arthritis just comes in. That's not related to diet. But if you have a bad diet, you have faster case of joint arthritis. But if you have a better diet, you might last longer. Acupuncture and surgery, very case dependent. Sometimes acupuncture need a repetitive visit to the doctors for acupuncture. And surgery, after surgery, I believe UC2 also comes into the picture whereby it is to maintain the successful surgery. So what is UC2? Now, most of you must have heard of glucosamine, chondroitin, HA, and blah, blah, blah. But UC2 has been launched in the world for the past 30 years. It came into Malaysia 10 years ago, brought to you by us, Peyer Laboratories. Now, UC2 stands for undenatured collagen type 2. And this undenatured collagen type 2 is not the normal collagen that you purchase from pharmacy when you drink it and you look like 20 years old. In fact, you're 40 years old like me, right? So if you keep taking the collagen in the pharmacy to buy, you just get to stop aging. We don't get younger, right? So you just get to stop aging, but it does not stop your joint from degenerating. So the unique mechanism of UC2 is it actually deactivates. That means you have a switch to switch off the degeneration and the inflammatory process of the joint degeneration or the joint osteoarthritis or the joint arthritis problem. It is derived from chicken sternum cartilage. If you guys are wondering what is chicken sternum cartilage, it is that soft bone in between of their chest in chicken, and it has to be processed within 2 hours after they are slaughtered. So that's why UC2 factory, now UC2 is owned by Lonza. If you type Lonza in Google, you will know that Lonza is one of the biggest Switzerland companies right now. And they are actually invested in the vaccine for COVID-19 with one of the companies in US. So the good thing about UC2 is you do not need to feed 1,500 mg per day to your patient or to yourself. You only need to take maximum 40 mg or 80 mg, 20 to 80 mg per day. It will work perfectly well. So clinically proven. Now through the slides, I'll be showing you some clinical studies. I'll be showing you how the joint degenerate. I'll be showing you how UC2 is absorbed into the system, unlike glucosamine, whereby it induces your body to work harder to generate the synovial fluid to replace the losing synovial fluid. In layman terms, if your engine is leaking of engine oil, and every day you are opening up your engine cover and pouring in the engine oil so that your engine will work, but the leakage is still there. Okay? So in this case, UC2, actually when you put in UC2, it stops the engine from leaking. That's how it works. This is a general term, right? A layman term that everybody will understand. This shows the absorption pathway of UC2. Now, technically, UC2 will not be ingested into the system. That means it will not be digested, it will not be absorbed by intestine, and it will not be taken in, right? So the whole process mechanism of action is, it will go through the stomach, and then when you reach the intestine, there is a small place which is called Peyer's patch. And this Peyer's patch will absorb the UC2, will stick to the Peyer's patch, and then will send a message to the brain to turn off the specific T cell that attack the joint. Again, joint is inflamed, debris is everywhere in the joint. Our system recognizes that this debris is alien. Our system, the system will create T cell to attack the joint. It causes the joint to swollen, inflame, and when you put NSAID or painkiller, anti-inflammatory inside, it will stop the inflammation around the joint so that the joint will heal by itself, while you are putting in glucosamine so that the synovial fluid can be replaced, and you give them to eat chondroitin so that the muscle can be relaxed and the joint can move back to normal. But with UC2, you do not need NSAID, you do not need glucosamine to refill the joint fluid, you do not need chondroitin to relax the muscle. Reason is, once you took UC2, it switches off the T cell that attack the joint. Once the joint stops inflaming, synovial fluid will not be leaking, or it stops the leak. Normal generation of synovial fluid by the host body will replace the fluid, and once the inflammation is off, the the muscle will be relaxed, it will not be swollen, it can move back by itself. So one UC2 replaces 3 steps of what human has been doing for the past so many years. Now, what is Peyer's patch? Okay. Now, Peyer's patch or gut-associated lymphatic tissue are similar to lymph nodes. Okay. So what UC2 does is that it will stick it at the Peyer patch, which is adsorbed to the specialized cell, and we call it M cell in the Peyer patch. And this is where it will send a message directly to the brain. So that means UC2 is not ingested, it will stick around the Peyer patch. It will tell the system to switch off the T cell, to stop attacking the joint. And that is how it works. So what does this mean? Means that those people which is allergic, it does not ingested, so you have no sign of allergic to food. It is not food. It is not ingested food. So it is safe for high glucose diabetics patient. It is safe for, it does not intervene with the heart process if the dog has any heart problem, right? And it is very safe for kidney or liver because it does not go through all this process. So what it does is that it is not ingested. So other organs are not affected. It just sticks to the Peyer patch, the side of the wall of the Peyer patch, and by sending message to the brain. Okay, now let's go to clinical study. What have they done to show that this thing will work better than glucosamine and chondroitin combined? And all these are clinical studies, journals published. This one has been quite some time, if not mistaken, it's 2007, 13 years old. Now, there's 100 dogs tested into 3 batch, placebo, glucosamine, chondroitin, and UC2. So they take a record of these dogs on an interval of 0 days, 30 days, 60 days, 90 and 120 days. The record is 120 days. And they found out that at the end of 120 days, UC2 is 50% more effective compared to glucosamine and chondroitin. And UC2 work faster in reducing pain in animal. I'll show you the chart after this. Now, the Canine study overall pain assessment is on day 0. This is what you get. The blue one is placebo, GNC is the center, and the green one, this is the group that they have tested. Now, how they test it? Basically, they have a gum force plate. They put the dog on the gum force plate to see the pain manipulation of the dog, how much force they can put onto the plate. It is one of the most recognizable clinical study that we have ever done by UC2 those days, right? And even today, it's also being recognized as one of the most accredited, someone is saying something, most important studies that have done on joint pain assessment. So on the 30 days, they found out that UC2 and glucosamine actually works almost the same in pain assessment. And on the 60th day, you will see that UC2 surpassed the recovery of GNC. On the 90th day, it is still surpassing, but on 120 days, you will see that UC2, 60% of respondents is higher, very much higher, better compared to glucosamine and chondroitin. So overall, pain reduction in UC2 is 62% compared to GNC. Pain upon limb manipulation is 91%. 90% of the dogs has less pain when they can move around more freely. Exercise associated lameness, they are very active. 78% of the dogs is active compared to GNC 42%. So UC2 significantly better than glucosamine plus chondroitin, right? Now, this is another clinical study that I've tested on the rats. Alright, now this is the latest UC2 journals that we have. It is done by Pfizer actually, right? And Pfizer is using UC2 in their treatment for joint. So we have a model of using a rat model of OA, they have 20 male rats that is induced with OA. 8 weeks, 10 rats receive an oral dose of UC2 of 0.66 mg per day. Now this one is equivalent to our dosage, which is 40 mg up to 40 kilo of animal weight. 20 mg equivalent to 20 kilo of animal weight, right? So separately, while another 10 rats will receive vehicle only, which is placebo, and separately 10 naive rats serve as intact control, and 10 rats receive sham surgery, which is regular. So dynamic weight bearing capacity in front of hind leg, serum biomarker, and cartilage metabolism, integrity of subchondral cancellous bone and the trivial aphysis, and using imaging. And they found out that found that UC2 starting immediately after the injury, it supports the joint from breaking down before it happens, right? So meaning that it is also a very good preventive product, a nutraceutical. So comparing to after injury or before injury, so this thing also works as a preventive product. So you can advise your patient to take UC2 as a joint prevention. And the best thing is it is not ingested, so it has no side effect to your patient if they take this on a long-term basis. Now the slide here will show you the destructive cycle of UC2. As you are aware, aging, stress, injury causes wear and tear in joint. And when this happens, pro-inflammatory cytokine kicks in when the joints are injured, and the upregulation of collagenous will follow through. And after the third stage, we call initial breakdown of damaged cartilage. This is where the erosion of joint comes in, the erosion of cartilage of this joint, and the T cell, which is the joint inflammation T cell, the white cell, they're going to infiltrate the knee, and the knee will be swollen, right? And it's inflamed. This is where most of the advanced OA animal has problem of moving, limping, lying down on the ground, and can't even go to the toilet. And in fact, they have to pee on the ground all over their body, right? So what I'm going to show you is where does UC2 comes in to stop the whole cycle. Now glucosamine will only comes in around this area. If you can see my arrow, this is where glucosamine will stop the destructive cycle, because glucosamine cannot stop the upregulation of collagenous, right? So UC2 actually stop at the first stage when the problem starts. So meaning that if the animal has no joint osteoarthritis, and if they are taking UC2 on a constant basis for prevention method, so if there is an injury, right, the animal will only arrive at stage 1, and all these processes will be eliminated. It will be stopped. Right? There will not be a joint degeneration after all. Okay, so this is what you call UC2. So Maximus joint on its sole basis, as I was explaining earlier, the sole ingredient of Maximus joint is UC2. You already know, no, this is a new term for you. All this while it must be glucosamine. Now this time the UC2, undenatured collagen type 2. Now this is something new, right? Does not make the body work harder to generate fluid, right? It has no side effect. It is safe for animal with heart problem, liver problem, kidney problem. It has no side effect at all because it's not ingested, right? Just pass through the system, stick it to a Peyer patch, send a signal to the brain to switch off the T cell, right? But again, let me be specific. It switches off the specific T cell, right? It does not switch off other T cell other than the joint, right? So it only works at the joint. Now, this specific T cell that UC2 switch off is the joint T cell. So if you're using UC2 for your backbone, alright, cool iPad, backbone. Now this backbone, if it affected the joint of the bone, it will work. But you have flu or you have like a sore throat, T cell that attack your sore throat, it doesn't work, yeah. So it doesn't work on that T cell. Now, Maximus joint, we have two sizes, right? So in our term, in our company, Pediatric Laboratories, we call it Maximus joint 60, which is the 20 mg Maximus joint, right? Which is this one, the purple one. And Maximus joint 90, which is the 40 mg, which is this one, the big one, right? So the difference is the dosage of each tablet is different now. The Maximus joint 60 contains 20 mg of UC2 in each tablet. So again, back to our clinical study just now, 0.66 mg per kilo, we are putting extra up to 20 mg per kilo. Now, a lot of you might be confused and ask, should I cut into half if the animal is 10 kilo or if the animal is 5 kilo, is it? So we do not suggest that, right? Now, based on clinical study, they have done the study on that part is to show how efficacy is UC2, but in real life, things does not perform as possible because this is not drugs, right? This is actually food. It's chicken sternum cartilage, derived UC2, right? So what we are actually aiming at, we feed 20 mg to animal up to 20 kilo. That is the safe spot. And we feed 40 mg of UC2 for animal between 21 up to 40 kilo. So every 20 kilo, we should put in a 20 mg. So that will be the safe side, right? Now, the best part is, it is cheap, right? 20 mg start from 1 ringgit 78 cents per day for stopping joint degeneration. That is cheap, isn't it? And 40 mg start from 3 ringgit 21 cents. Now, why we have 40 mg and why we have 20 mg? As you can notice, if you times 1.78 the 20 mg price to 2, you get 40 mg. It is much cheaper than compared to 20 mg. So certain clients might say, I want to buy the 20 mg and feed 2 to my dog. They can do that, but it is not economical viable. I mean, it is not cheap, right? But certain patient will say, I would like to buy the 40 mg and split it into 2 so that my dog can eat half a tablet, which is 20 mg. We also do not suggest it, but they can do that. They can do that. Only thing is that it will be cheaper. Only thing is that sometimes it might not be cut perfectly by half, and they might have 22 mg and 18 mg on one. So if the dog is at the borderline of 18 kilo, that would be very dangerous to see the significant improvement on the joint covering, right? So this is how it's supposed to work. The difference between Maximus booster and Maximus joint just now is we have added in an anti-inflammation ingredient which is called Aflapin into Maximus joint booster. So in Maximus joint booster, it contains UC2, 20 mg, and it also contains 50 mg of Aflapin, which is called Boswellia-derived gum resin extract. Now, what is Boswellia-derived gum resin extract? Basically, it's just a herbs, all right, and it works to stop inflammation. All right. So how does it? Why do we put it in? We want the effect to be faster. Now, certain patient, when they are having glucosamine and they would like to change from glucosamine into UC2, the problem with glucosamine changing to UC2, there is a hollow effect which is in the middle, whereby they will deteriorate on their mobility before they can climb back up after 30 days of using UC2. So to stop this, so to enable the patient from glucosamine changing to UC2, we have added in Aflapin, and this Aflapin is actually cut off any inflammation that happens at the joint. As you can notice from our clinical study just now, UC2 needs about 30 days to kick in, right? And oh yeah, one thing that I must emphasize here, some glucosamine need you to double the dose for first month for their patient. that would be very expensive. Glucosamine itself is really very expensive, and if you double it for the first month, it will be double by month for the owner, right? In UC2, you do not need to double dose it, right? You only need to give them more Maximus joint booster. Inside it has UC2 and the Aflapin will kill off whatever excess T cell which is already at the joint. Now UC2 switch off the T cell that's applied to the joint, but the joint area still has some T cell which already existed. So why we put Aflapin is, even though UC2 switch off the T cell from supplying T cell into the joint, the existing T cell will stay there for another 30 days before it goes away, or it takes time to heal. And that is why we put in Aflapin to kick off the T cell. But your question might be, I can put NSAID, I can put steroid, I can put some pain relief into it to stop, or I can put some anti-inflammation to stop the joint. Yes, you're right, but not every dog can take NSAID. Some aging 13, 14 or maybe 15 years old dog might have some problem taking NSAID, and sometimes they do not bring their dog to see you, and they will just want to buy Maximus booster. But I don't know, sometimes you guys might not be able to sell it to them, but certain might be able to sell it to them, even though they don't send the dog over. But again, this will be the safer pathway rather than prescribing them a joint pain relief, so that might have some effect afterward, right? So that is why we put Aflapin. Again, back to just now, glucosamine changed to Maximus joint, UC2. We put Aflapin so that it can bridge the transfer, firstly. Secondly, Aflapin is used to make it, to stop the inflammation faster. That is why you can see that the dog or animal which take Maximus joint booster has a better, faster healing rate compared to UC2 alone if they just started UC2. Alright, and again, we are the first one in the world that has these two patented ingredients. So UC2 is one of the patented ingredients. Aflapin is another patented ingredient owned by two different companies, and we has the sole distributor right for it, for Southeast Asia. The safety toxicology test on Aflapin, on Boswellia-derived Boswellia strata gamma resistant extract. Now, it is being used as an ailment in many cultures for anti-inflammation, and it is patented in India, right? And this is the patent code. The clinical study they have done on this on rats, right, have shows that it is safe to be taken, and they have found that there will be no side effect to it. There's no they demonstrate broad spectrum of safety of Aflapin, and it means this thing is safe. It can be taken for long term. There's no significant sign of toxicity. But again, we actually created a product called SONADIL, which is Aflapin standalone product. Just because that a lot of people are asking for a safe, long-term anti-inflammatory agent, whereby they see the efficacy in Maximus joint booster. So we just took out Aflapin from Maximus joint booster and make it a standalone product, and we name it SONADIL. Now it comes in capsule form. It is aimed for anti-inflammatory support, especially aging dog, cancerous, last day of cancer, and other inflammatory marker that you need. For sensitive dog, which is sensitive to NSAID and steroid, and the owner needs something kind of the inflammation, this one comes in quite handy. One capsule, it contains 100 mg of Aflapin. Alright, one capsule will cost you about 273 cents to end user. It works up to 40 kilo. Again, not supposed to open up and split into two, because once you open up and split into two, it will be oxidized and it will be hardened. They are supposed to feed up to 40 kilo. Even though the dog is 2 kilo, we still feed them in one. So far, product has been in the market for 3-4 years. Response is very nice. There's no side effect or adverse effect or any complaint of whatsoever of gastric problem or even liver or kidney problem, because it's safe. Maximus Pro GI. Maximus Pro GI, it is not lactobacillus. It is not bacteria. The patented code name for this product is called Lynside Pro GI Plus. As you can see the resemblance of the Pro GI, and we use it into our packaging Maximus Pro GI. And even on the packaging itself, you might see this Lynside Cerevisiae CNCM I3856. Now that CNCM I3856 is the patented code for this probiotic yeast that we bring into Malaysia. One of the best probiotic in the world, right? From France, right? It has no sensitivity to antibiotic. That means because it is yeast, so it can go together with antibiotic when you do a treatment for diarrhea or intestine bacterial infestation of the intestine. You need antibiotic to eliminate the bad bacteria. At the same time, you can put in Maximus Pro GI together with the antibiotic, and Maximus Pro GI will grow the good bacteria, while the antibiotic will kill off whatever bad bacteria that they have. Right? They have no risk of bacterial resistant transfer. That means prolonged usage of Maximus Pro GI, it will never induce any resistant transfer. That answers your question. I mean, how long can you take Maximus Pro GI? So, not pro-inflammatory, naturally resistant to gastric acid and bile salts, better stability at room temperature. You do not need to store it into the fridge. You can withstand up to 40 degrees Celsius. Right? Mechanism of action is slightly different compared to bacteria, the normal probiotic bacteria. So this one is more stable. I'm showing the chart of, they have done a few clinical study of how this Pro GI works on Candida albicans. Alright, so from the chart you will note that the administration of Saccharomyces cerevisiae reduces significantly the colonization of Candida albicans in feces. That means it is able to reduce the bacteria. And this chart shows that how Pro GI against E. coli strain in gastrointestinal condition. So within a time zone of 300 minutes, right, you will note that it is able to reduce the colonization of E. coli in the intestine. So can it be used for chronic diarrhea case? Yes, the answer is yes. Alright. And again, this product is the first probiotic, and it is designed by Aflapin in France, and we bring it into Malaysia directly. But once you open it up, alright, it comes in a sachet form. Once you open it up and pour it out, you will notice that there is two types of powder in the sachet. Now, the fine powder, which contains about 900 mg, is inulin, which induces good bacterial growth, right? And then you will see some small little sediment, yellow sediment. That one is actually the Max Pro GI, right? That's the probiotic yeast, and it is not dilutable in water. We suggest you to pour directly into the mouth of the animal, and if you are going to feed it with bath or wet food, we suggest it to wet it in a small portion so that you can feed it immediately. Not supposed to mix it with their bowl of kibbles, because if they don't finish the kibbles, it will oxidize, it will grow out of range, and then eventually have no function. So what Max Pro GI does is that it reduces inflammation, it improves microbiome, and it reduces visceral hypersensitivity. That means it promotes better intestine, which is not sensitive, not so easily sensitive.